Good morning, good people. My name is Caroline Bithe. Welcome back to the GTV. This is the Afya Leo program, and we are here to educate you about health, that is mentally, emotionally, physically. We want you to at least have a little bit of information ndio pia tuweze kujichunga tukiwa hapa nje. And guess who is back with us in the show? Madam Rhoda, introduce yourself to our viewers.
Good morning, viewers. Once again, my name is Rhoda. I'm here. I thank GTV for giving me an opportunity this morning. Welcome.
So today we are talking about cervical cancer, and you will be helping us understand more about this cervical cancer. In the first place, help us understand what is this cancer?
Okay, first of all, I'd want to say cancer is a malignant tumor. What I mean is cancer is abnormal growth of cells in the body, in a specific organ or in an extensive organ. So the excessive abnormal growth of body cells can lead to cancer.
Okay.
Yeah.
Cervical cancer?
Cervical cancer is a malignant tumor in the cervix. Cervix is the entrance to the uterus. And therefore, if there is abnormal growth of cells excessively around the cervix, it can be called cancer.
So, just to help our viewers na sisi pia kuelewa, cervical cancer ina affect wanaume ama wanawake?
Cervical cancer ina affect kila mtu. Lakini sana sana it affects the women.
And what causes cervical cancer?
Cervical cancer is caused by a virus. Virus, it's called the human papilloma virus. It defines itself a host, which is the reproductive system of the woman. It can also find itself in the men because it's transmitted sexually, but symptomatically it can be found in women more than men.
Okay, and age group, ni watu wagani? At what age can someone develop cervical cancer?
Cervical cancer actually has no age group. As long as a person is sexually active, they are prone or they are exposed to cervical cancer.
Okay.
So we cannot say about age group, but we can at least say those who are sexually active. That is around 9 years to 50 to 60 and above.
But there is this cervical vaccine that was the government iliambia watu wadungwe.
Okay.
Na ilikuwa inaanzia watoto wadogo. What was the purpose?
The purpose why we were giving young girls, it is because after research, or rather, when we look at the way women behave, it was not exactly meant for young girls. It is meant for women of reproductive health, of reproductive age. But now when the vaccine was introduced, basically it was found that those who are between 15 or below 15 years may be sexually inactive, or rather their rate of exposure is low. So it was found a reason to give them more than the other women, because already those other women are very active and they are exposed and they are so much prone. So it was assumed that these young girls have not been exposed so much.
Okay.
And actually when a vaccine is introduced to somebody who is exposed, it does not work.
Okay.
Yeah.
What are the signs and symptoms of cervical cancer?
Okay, signs and symptoms of cervical cancer. First of all, a woman who is developing cervical cancer will come to the hospital several times. They start with low abdominal pains. Some of them will tell you they are having pain during intercourse. Others will tell you they are bleeding after intercourse. There are others who will come with bleeding in between their menstrual cycles. So then others will be recurrent in the hospital with urinary tract infections, sexual tract infections. That is to show, or rather, those are signs, suspected signs, because we cannot say there is cervical cancer unless we diagnose.
Okay.
Yeah.
Now, you've talked about bleeding in between menstrual period.
Mm-hmm.
There are some people who do that a normal cycle goes for 28 days.
Okay.
But after the 28th day, you go for about a week,
Okay.
and then you again, your menstruation is back again. So
Okay.
that's not normal.
That is not normal. What happens in the reproductive system of the women, remember the body is controlled by hormones. So at times this could occur because of imbalance of hormones. The hormones that are in the system of women, like estrogen, most of the times people suffer imbalance. So we cannot, that is why I said we cannot say they have signs of cancer, but it is one of the signs. But bleeding in between periods can come as an imbalance of hormones. It can come because of use of contraceptives. It can come because of other changes in the women, or other even mental changes, emotional changes can bring that. So it is not specifically for cancer.
Okay, and
Yeah.
how is cancer transmitted? You've talked about it's sexually transmitted. That's the only way it's transmitted.
Yes, the human papilloma virus, which causes cancer, is transmitted sexually. So there is no other way. It is just sexual intercourse.
And it's said that men transmit this cervical cancer to women.
Yes.
How does it happen that a man has this virus?
A man will just be a host, but the symptoms will not occur. The symptoms will affect the cervix, and the cervix belongs to the women. But in men, the virus becomes just dormant. The man becomes the host, but it cannot affect the man.
Now, how can you tell that a man is a host of that virus?
It is very difficult to tell that.
So you can't. It can't even be diagnosed in the hospital.
It is not. No, it is not yet. Locally, we cannot. But in advanced laboratories, they can diagnose. But in these setups, normal setups that we are working in, it is very hard to diagnose from men.
Okay.
Yeah.
And there are different stages of cancer, right?
Yes.
So help us know more about these stages of cervical cancer.
Okay, in cervical cancer, I told you there are some symptoms that are related, and they are not, the true diagnosis cannot be made from the symptoms. So the first, there are 4 stages actually, and the first stage is usually asymptomatic. What I mean by asymptomatic is this person will not report to the hospital saying that she has MBCD. But during routine checkups, you know, there are routine checkups. Many a times we are advising women to go for checkups. So during this routine checkup, somebody we can find out some cells that are occurring, excessive cells that are occurring in the cervix. But in this stage, this person is silent, there are no symptoms, there is no pain, there is nothing. But when they go for a routine checkup, something is happening. That is stage 1. Then there is this stage when we screen the cervix and we find that already the cells have developed, and then the cervix is already being affected. Remember, when we screen, usually we have many types of screening, but locally we have the simple screening method, which shows us when cells are developing excessively. So during the second stage, we are able to find some kind of erosion, some kind of inflammation, and then it is extensive. It's more extensive than when it first began. Then during the third stage, the symptoms are already clear. The person will come, they'll explain to you they are feeling pain, they are not able to do sexual intercourse, they are bleeding in between the periods, others bleed after sex. So when we screen at that stage, we are able to view the cervix and see that this is now cancer setting in, you know. So we can view when cancer is setting in, and we can view when the cells are have multiplied. Remember, multiplication of the cells does not mean the person has cancer, but it is something to signal and tell us that this cervix is not normal and we could be leading to cancer. So the third stage we are able to view and suspect cancer. We cannot truly see it is cancer because there are other tests and there are other advanced tests. So at this time, the woman has already full symptoms, at least the 4 symptoms. Then during cancer stage, that is the 4th stage. The 4th stage is automatically the woman will not be able to do anything because of the pains. This one leads the woman to the hospital. She's hospitalized. It is now the stage that brings the advanced management and treatment.
Okay.
So the viewing, actually the simple method of screening is called viewing. So the viewing is able to tell a professional that this is stage 1, is stage 2, stage 3 and 4. But usually stage 1, it is very hard to diagnose.
Okay.
Yeah.
So hold on there. We will be back after the short break.